Hi, this is Jamie Michelle, the founder and president of Gays Against Groomers. I'm so excited to let you know that our organization just launched our first book. That's right, Gays Against Groomers now has a book. It's called The Gender Trap, The Trans Agenda's War Against Children, and it is the book the radical gender mob does not want you to read. If you are a parent whose son or daughter is questioning their identity, if you are puzzled by how the radical transgender movement has penetrated every area of life, if you feel abandoned by an ideology that distorts everything you always knew to be objectively true, if you have ever been ostracized simply for pointing out the obvious, or if you just want to know what on earth is going on, this book is for you. Head to thegendertrap.com to get yourself a copy today. I promise you're not going to want to miss this. And if you'd like to support Gays Against Groomers and the work we do to end the war on children, please head to gaysagainstgroomers.com for ways to donate, get our official merchandise, or even join the team. Thank you so much for your support and enjoy the episode.
Welcome to the dark side of the rainbow. This is a production of Gays Against Groomers. I am your host, Robert Wallace. And today we're going to be featuring an interview, which I just had with a Dr. Eithan Haim. Dr. Eithan Haim is a general surgeon here in North Texas who's become well known for his whistleblowing regarding activities which occurred at the Texas Children's Medical Center. And as a result of the things that he's exposed, there has been a major pushback against him, even while the laws changed to support the conclusions that not only he arrived at, but that he was standing up in the protection of children for. You're going to hear the matters surrounding his own personal case, but also the details of what happens when a child begins this path of transgenderism, the procedures that take place, and the consequences that follow as a result of these operations. We talk a bit about the philosophy behind doing the medical job and what needs to really be done in order to head off the destruction of this next generation. So if you enjoy this, please like, subscribe, follow, etc. You'll be given the address, which I'll give you right now, if you would like to contribute and help this doctor who's fighting for the protection of children. That's GiveSendGo/Texas_whistleblower. And I think you're going to find this very instructional. Learn a lot, and we'll see you on the other side of the rainbow. Gays Against Groomers presents The Dark Side of the Rainbow. All right, we're here with Eithan Haim.
Yeah, thank you for joining me at my home. It's great to have you.
It's our pleasure. Now it's Dr. Eithan Haim. Is that correct?
Yes, sir.
Okay. So all things said, you're still a doctor.
But you could just, call me Eithan. That's totally fine.
Okay. So if you would, for our audience, tell them a bit of what brought us to this point.
Yeah. Well, I'm just an average guy from Florida. I grew up in Orlando. I have a brother and a sister, great parents, very close. My dad's a doctor. And I saw how much his patients cared that he was the one taking care of them. And, it was really inspiring because, you see how much help how much he does for his patients and how much they care about it. So I wanted the same thing for myself. So I went to undergrad in Florida, medical school in Florida Atlantic, and then I got into my general surgery residency training at Baylor College of Medicine in Houston, Texas. And for me, that was a big deal because it was a very prestigious program. It's one of the best surgery programs in the country, right? You're training at Ben Taub, which is the big trauma hospital, St. Luke's, which is a big tertiary care, a bunch of cancer surgery, but then also Texas Children's Hospital. We spent a lot of time there throughout all 5 years of training.
Okay. So when you were at the Texas Children's Medical Hospital, and you heard that they were going to discontinue their transitioning program, and then it came to light to you a few days later that they were actually still doing this.
Yeah.
They just, I believe in the Tucker interview you just did a couple days ago, you stated that it was like 3 days later they were doing a puberty blocker in an 11-year-old girl or something.
Yeah, I mean, it was absolutely shocking. And I had found that out, maybe a few months after that statement in March of 2022, where they said they were stopping the hormone-related interventions related to gender dysphoria because of the legal risks. And that's important for people to understand. They acknowledged that there was a major legal risk with them continuing it because the Attorney General of Texas had issued issued an opinion a few weeks before saying that it can be investigated as child abuse. So, mid 2022, I started hearing that they're doing these procedures on 11, 12, 13-year-old kids. And I can't believe it because I had become more aware of it over the preceding year or two because everything changed with COVID. I started my training in 2018 and then, all this started happening in 2021, 2022. You start hearing about these gender-affirming hysterectomies, gender-affirming mastectomies. You imagine it's going to happen in Washington or California, but you definitely don't think it's going to happen in Texas. And you definitely don't think it's going to happen at your hospital. But I had found out not only was it happening, but the hospital was lying about it to the public. Because not only did they continue the program, right, but they expanded it into a multidisciplinary clinic, right? Social work, psychiatry, psychology, endocrinology. The directors of the program, the transgender program, which supposedly did not exist, were given the opportunity to speak at the hospital's most prestigious lecture series. You had a social worker who was involved in the program who talked about how she was concealing consults, written documentation. She wouldn't write them down because of the risk of scrutiny from governing medical bodies. And this is 7 months after they said they were shutting down the program. And, I realized the degree of the transgression against basic medical ethics. I have a responsibility as a doctor. I have a responsibility as a human, not only to my profession, but to these kids to do something about it.
Absolutely. And that's wonderful that you put those morals and ethics above anything else. Because so many people are going to put their career front and forward. They're going to put their reputation or their, popularity amongst their peers ahead of that.
Yeah. Well, I think that people have to realize that there's, for me, for medicine, there's no career without ethics, right? There's no surgery without ethics or morality. Like if you do not do the right thing, then you cease to become a doctor, right? So in order for me to maintain this profession that I took an oath to, you don't only have that responsibility in the clinic or the operating room, but everywhere else. And when you see that the biggest children's hospital in the world is lying about a program that is manipulating, mutilating, and sterilizing confused adolescent children, right? You can't even believe that's happening. And it really took me weeks to acknowledge, to come to terms with it, because I thought they must have said something to indicate that they were restarting it back up. Mm-hmm. But no, it was nothing. And I thought there must be something on the internet. They must have a web page for the transgender program, but nothing. So it became very clear that they were concealing the existence of this program. And if doctors are doing something behind closed doors that they don't want the public to know about, there's a very good chance what they're doing is very, very wrong.
That's absolutely a valid conclusion to come to. Like, why wouldn't you want people to know
Yeah.
if there's nothing wrong? Do you think that the medical system has become weaponized?
Yes, I think that the best way, I spent a lot of time thinking about this because, so many of us had the same experiences where the past couple of years we talk to each other and we think, how did things get so crazy? How did we get to this point that we're even having this conversation, like me and you, about, permanently changing the physiology of like 11-year-old kids, right? And I think it's not necessarily weaponization, but rather inversion, right? Where you had the inversion of our society's institutions, where medicine is not meant to keep people healthy, but to make them sick. The justice system is not meant to protect the innocent from criminals, but criminals from the innocent, right? The education system doesn't make people smarter, it makes them dumber.
Mm-hmm.
And, in my case, I've, had close interaction with the, two of those systems, which demonstrate this inversion. But yeah, it's like they are serving the exact opposite purpose of what they're meant to do, right?
Yeah, exactly. And so when do you think, this has become a very politicized issue, the issue of transing of kids. And do you think within the hospital, when with the idea really being, because I remember you talking about how it seems that a lot of people, their motives behind what they're doing has a lot to do with their own personal ideological beliefs about the matter. And a lot of this has turned into an issue of either you respect to gay people and you respect trans people, which means the gender affirming care is done without question, or you're homophobic or transphobic because you don't think that you should go this far. So in the medical field, do you think that the polarization of these ideologies is very strongly experienced, or do you think it's like a very subtle thing?
I think that when you had COVID and everything that happened after, the environment within academic medicine, and that's the environment I was in, was the prestigious American academic surgery. It became not a culture of thought and free inquiry, but censorship and ideology. So I wouldn't necessarily say that it's become politicized, because most people know this is wrong. Most people I would talk to know this is crazy. But because the ideology has become so powerful and the censorship so severe and the repercussions of speaking out so severe, that people stay silent, even though everyone knows this is not medicine. This is something completely different.
I see that. Absolutely. How would you characterize what's being told to patients as far as the repercussions of what they're doing versus what's actually happening with regards to these puberty blockers and hormone replacement therapy?
Yeah, well, I think it's a manipulation of basic facts. Oh, really? Yeah, really. They're just being manipulated, because I'll just use a few examples. Number one, they say puberty blockers are reversible. And I think a good analogy is like puberty blockers are reversible, like dangerous street drugs, are reversible. If you use it one time and you never use it again for the rest of your life, you're probably okay. Right. Probably no long-term effect. But the reality is that most people who use street drugs become drug addicts. Right. And when you look at the way puberty blockers are being recommended in these situations, there's no off-ramp. Right. Once they start, 95+% go on to cross-sex hormones. Once they're at that point, there's no going back, because when you're on puberty blockers for so long, you do not go through your natal puberty. So your development of secondary sexual characteristics, what I mean by that is, like penile growth, hair growth, clitoral development. That's not going to be done for these kids who are blocked. So you'll have 18, 19, 20-year-old kids who have the, penis structure of an 11-year-old. And then that's what happened to it's a famous story of Jazz Jennings, mm-hmm. right? Where because he had never been exposed to testosterone. He had a micro penis. They didn't have enough skin for this wound they were creating, what they call a neovagina. So they had to take tissue from elsewhere, from inside of his abdomen, his peritoneum, and the lining of it, right? And that's a morbid procedure too, right? It comes with major risks. Before that, they were using colon. They would actually cut out a piece of colon using the inside lining of it. Of course, that can cause really bad infections. There was one of the patients from a study, I forget, I think it was in one of the European countries, maybe a study of 20, 30 people. One of them died from a necrotizing infection after that surgery. Wow. So yeah, these puberty blockers, they're being manipulated because they're saying it's reversible, but the way it's being prescribed is not reversible. They're meant to stay on these medications for life. And people always think that the medications are less severe than the surgeries, right? Because surgery kind of has this connotation, right? It elicits emotion because you have the surgeon, the instruments, you have this kid being wheeled into the OR, and you have these misguided surgeons completely changing their anatomy. But when you have these kids start taking these medications, 11, 12, 13 years old, it's going to affect the most critical structures, critical hormonal processes in their body. So it's like a million microsurgeries happening every day, but it's on the cellular level. So you're not going to see it. You're not going to be able to appreciate it.
Wow. That's a really good insight. Cause
like there's no surgery in the world that can cause your bones to become osteoporotic by the time you're in your 20s. There's no surgery in the world that can, deprive your brain of testosterone and estrogen, right? The things that are needed for development, right? So it's important for people to understand that, like, this is not a small thing.
Right. Absolutely. So I like the way that you put that it's like a million microsurgeries happening every day.
Because when you have someone have a mastectomy, right? They go in 9 o'clock. 2 hours later, they come out completely different person. It's understandable for people to be shocked by that. Or for when you watch the episode of Jazz Jennings, right, where he gets a vaginoplasty, right? A few hours later, he's completely different. But because these processes are slower, they're more insidious. They're easier for people to tolerate, to think that this is some middle ground that can be achieved in order to obtain sustainability. But that's completely false, because the reaction is due to the nature of our perception is based on the emotional reaction to the intervention. So the emotional reaction to surgery is very high, so people think that's more severe. But our emotional reaction to medications is just not as strong, because it's just like a shot. It's just like a pill you take, or most of them are shots or implants. But it doesn't seem as severe, but it is as severe. Absolutely.
Wow. And what do you think about these people online who are like saying, hey, I can send you, your puberty blockers or your hormone replacement therapies through the mail and nobody has to know? Is there, without the oversight of somebody who knows what they're doing, what kind of dangers are they putting themselves in?
I mean, I couldn't even fathom. I was talking to a group of parents 2 weeks ago, and they were mothers and fathers in Dallas who have children who've been caught up in this ideology. And, the parents didn't have any resources, right? So they had to find each other. They had, through this, secret process of vetting and signal texts, you have this big group now. And there was one mother in California who told me that her kid was caught up in this ideology and had a friend whose parents were biology teachers, and they had gotten hormones over the dark web, which, who knows what that is, right? What they're really getting. And it was the friend's parents, the biology teachers, who were injecting this kid with hormones. They don't know what the dose is. They don't know what the substance is. I mean, we see problems all the time where people inject something into their arm or their leg and they get some necrotizing infection. We have to chop their leg off. I did a case like that 3 weeks ago, right?
Wow. Yeah, that's serious business. when you're using these things out of the context of the medical field in which they were developed and meant to be applied. When you first heard about the continuation of these trans processes that were taking place at the Children's Medical Center, and it became more frequent that these things started to happen, how frequent would you say?
Well, it's important. I don't know. And the reason I don't know is because a lot happens in the clinic that we don't know about, right? Where they get shots, the documents Rufo had exposed just showed the surgical implants, and you can see they were becoming more frequent. But the difference between the two is important because some kids will get monthly injections of puberty blockers if they can tolerate it. But, with kids, it's a little challenging. So if there are kids who maybe have a tougher time with doctors, more emotionally sensitive, then they're not going to be able to tolerate every month going in and getting a shot, right? These kids are typically ones on the spectrum, right? Other psychiatric issues, right? Like past history of trauma. These were the ones who were getting the surgery because they couldn't tolerate the office visits. So yeah, there's like a lot that would happen in the clinic that we don't know about.
Interesting. So what you're saying is that individuals who have a more difficult time with doctors in general, they're afraid of the hospital. They have traumatic experiences whenever they go and have their visits done. You're saying surgical visits, a surgical intervention will eliminate this expedites the progression of what these.
Yeah, because so the monthly injection, which can be given in clinic, happens on a monthly basis. But for kids who may not be able to tolerate that, they have the implant. And the reason that's the more viable option because of their emotional responses, to doctor's visits or whatever, is because they're under general anesthesia. So we take them to an operating room. We have a general, anesthesia doctor, and then, we surgically implant these little puberty blockers in their arms. I've done these procedures before, but on other kids with actual hormonal diseases like precocious puberty, right? Where you have like a really young kid, 5, 6 years old, who starts going through puberty. They're in a state of disease. And then when you put the blockers into them, that's treatment because you bring them back down to their naturally occurring physiological state. Once they're 11, 12, 13 years old, take it out.
How long do those puberty blockers, when they're installed, I guess, or surgically inserted into their arm, how long do they keep?
9 to 12 months.
Okay. And are they having to be taken and replaced every 9 to 12 months? Okay.
Yeah. And, putting it in is not the difficult thing. It's taking them out, right? Mm. Because you kind of like got to fish around some kid's arm.
All right.
And it's like a little tiny thing. So that's usually the more difficult part.
Okay. We all know the Hippocratic oath of do no harm. And that should obviously be guiding everything that's happening. It's not so obvious anymore because we see that some people think that, it's a subjective thing, whether or not you're doing harm to begin with. You obviously see the harm in what's being done.
Yeah. It's a good point that you brought up, subjective, right? Because I think that's a key word. Because people always talk about do no harm, but to whom, right? Do no harm to whom? Mm-hmm. Implicit in that statement, do no harm, in that oath, is the acknowledgement that we are doing no harm to a person, right? To another human. But why? Why should we do no harm to other people? Why does it matter, right? I mean, it might seem obvious to you and me, but like now we actually have to have these conversations, right? Mm. We do no harm to another individual because we acknowledge this basic human dignity in each living human being. And when you know that there's dignity behind that person, you would never do anything to hurt them because they're special, right? They're naturally dignified. So people say that medicine, like these days you always say, oh, well, medicine should be driven by science, right? I think that's wrong. That's why we're in this situation in the first place. Medicine is driven by morality, by our acknowledgement in the basic human dignity of our patients. Because if we lose that, then you can do anything to anyone. And we have seen that before many times. But if you do acknowledge that human dignity, there's this natural logic behind what you can and cannot do. Where the science comes in is to determine the effectiveness of certain treatments in certain situations. But at the end of the day, each treatment has to be guided not by science, but by helping that individual. Are you going to make them more healthy? And like the ultimate goal being restore the individual to the naturally occurring physiological state. 2 arms, 2 legs, lungs that breathe, and a heart that pumps, right? Like we all know what that feels like. It seems kind of elusive, right? But we all know what naturally occurring physiology is because we know what we feel like when we get sick or like when you hurt your knee, right? Like everything doctors are meant to do is to get you back to the point where you're in your naturally occurring state, that you don't need to be in a hospital, which is why what they're doing to these kids cannot be categorized as medicine, because they're not taking kids and restoring them to their naturally occurring physiological state. They're putting them into a state of permanent pathology, right? For the rest of their lives. Both the molecular processes in their body, but the macroscopic anatomy later in the course with the surgeries.
You know, when I think of what a doctor is, or what we used to call a doctor, in ancient Greece, we had our doctors of philosophy. And I think that's, goes hand in hand with what you're talking about in terms of morality. Some may see things through a religious view, some may see things through a philosophical view, but in either case.
Yeah. Whether you believe in God or you believe in evolution, if you believe in the basic dignity of another human, then you will always pursue interventions, decisions that will help them. Like I was doing surgery today, like a few hours ago. I have to be confident that the potential benefits are going to be worth the risks, because if the risks exceed that, then this is a dignified person. Like I can't do that to them, especially if I'm not going to solve a problem, right? And that really means something when they're under your care, right? When they're asleep, paralyzed, naked, around a bunch of strangers with sharp objects in the operating room. You have to make sure what you brought them there for is going to bring them back to their naturally occurring state of being.
That's a really amazing point that you made. This is not bringing people back to their naturally occurring native state.
Yeah. So would you define that as medicine?
No, yeah, I think in terms of cosmetic surgery, I think in terms of...
Yeah, but that's a good point too. Cosmetic surgery. People use that line. No, it's like, cosmetic surgery, we can do that. Pretty radical sometimes. Why not this, right? But the difference is a galaxy apart, right? Cosmetic surgery is modification. They're taking a nose and saying we can modify it. Before surgery, it's going to be a nose. We're going to modify it. After surgery, it's going to be a nose. Breast. Before surgery, breast. After surgery, breast. Different, right? Modified. But with this, what they're promising is not modification, but transformation. They're saying that you will become a woman, right? That's what they're saying. That if we do these interventions, you will become a woman. But you cannot consent to something that is not possible, right? So this is a completely different ballgame, right? We're not talking about modification. That's like way over here. We're talking about the potential of transformation, which of course is not possible. And of course, we see this in scientific history. I mean, one of the most common endeavors for famous scientists was transmutation. The desire to transmutate silver into gold, because if you can change this substance, this naturally occurring substance, by some magic way into something else, you become like a god. You can exceed the rules that govern our physical laws, but you can't, because we cannot govern the laws that dictate our physical world. We are subject to those laws, and there's nothing we can ever do to change that. It's like, if you think you can, beat the laws of gravity, good luck, especially if you're on top of a 10-foot building, like you're going to quickly realize that you may not believe in those laws or believe that you can transform them, but it becomes very real when you're on the ledge of a big building, right?
I kind of hear like a bridge being built here between like alchemy and transhumanism almost. I mean, I know generally transhumanism has a lot to do with inserting machinery into people, but this is like an intermediary step.
Yeah, I think that the transhumanism thing is interesting. It's like, you had this. I remember I read a book way back in the days, like Ray Kurzweil, the transcendent moment where like machines and humans will like merge or whatever. And I mean, it was kind of interesting for the first couple chapters, but then it got redundant. But I think the whole like transmutation into like higher human forms is more of like this, tech guy, who's like really smart, who thinks we can live forever, but like they have no understanding of human physiology. So they understand that like you can make like a super cool machine, but like if your blood vessels are like calcified like lead pipes, like you're gonna die, like you're gonna have problems. But I think what's happening with this is not necessarily this desire, well, maybe it is for some a desire to create this new human, but it's a desire for these people who are involved in it to find meaning in their lives, right? Mm-hmm. Because when they grow up and they don't have anything that's meaningful, right, that makes the pain and suffering that's inherent in life, if you don't have anything to make that worthwhile, then you're going to have to look for something. And this is providing them that. And you have doctors who grew up with no meaning in their lives. So this is it. Lawyers who grew up with no meaning in their lives. So they're defending these gruesome interventions, in all these different states, right? You have the activists outside, right, who have no meaning. And this is providing that to them.
I love that you say that. I'm a student of philosophy, and I enjoy spirituality and all of this type of thing. And we have a very superficial culture. And when we grow up like that, without any sense of who we are or what we're here for, nowadays we're growing up on iPads and tech and all this. It's like, what do you have to fall back on except external appearances?
Yeah. It's people have to have something that makes suffering worth it.
What kind, if any, of genuine benefits do you think actually come about through these procedures?
None. It's like massive hemorrhage from a patient. One of the first rules in surgery is that when you have massive hemorrhage, you stop the bleed. You put your finger on it, right? You do the 2-finger death punch, right? Find where it's bleeding, you put your fingers on it, and you leave it there, right? There's no benefit to this. Yeah.
Do you think?
Well, I think you probably have benefit to the hospitals and the pharmaceutical companies,
mm-hmm.
and then maybe some other people who may benefit from this industry.
Do you think, kind of going back to the question before, that there is more of a need? Like, on one hand, the discussion is around, okay, the patient needs to go and see a psychiatrist or a psychologist, and they need to have their mental state evaluated before they move forward. Do you think that as individuals, as the patients themselves, they should be given or caused to undergo some sort of psychological development of some kind?
I mean, of course, right? It's the majority of people who, the research has shown for a long time that the children who just go through puberty, the dysphoria resolves, right? Because how many bad experiences did like all of us go through when we were growing up, and how awful it was. And these doctors are providing them like this quick fix, right? This quick solution to these very, very difficult problems. And they're framing it in a way that if they don't do something about it, the kid's going to kill themselves. So already the stakes are escalated to the highest possible level, right? Because like nothing worse than this kid killing himself. It's like the worst tragedy of all time. So yeah, it's very malevolent thing.
Mm-hmm. What do you think about the parents, or how would you characterize the parents who are allowing or pushing in some sense their kids down this road?
I think that my opinion about this has changed a lot from meeting parents who, like that group we talked about earlier, parents whose children were caught up into this. And many of the relationships are gone, where they don't talk anymore, and the kid is doing God knows what, in Oregon or Washington or California in some foster home, right? Being abused by who knows who. And but then there's some parents who have still a tenuous relationship with their kids, and the parents had never pushed this onto the kid at any point in time, but it happened during emotionally delicate periods during their development. 15, 13, 14, 15 years old, they had a counselor that they talked to in school, and they got put down this road. They were told that this can solve your problems. And then these parents always talk about getting the letter, right? They say that one day you show up and there's a letter on your counter somewhere. It's usually, typed up, printed out, and talks about their new identity. So you have some parents who obviously push their kids into this Munchausen's by proxy, just like Gypsy Rose, her mother, using her daughter as a means to obtain psychological and financial benefit, right? But then you have some parents who are completely taken off guard. And I've met now at this point a lot of those parents, and it's very, very sad.
Yeah. I've also met some who've completely lost their kids to, like you were saying, the foster care system, and then they find them off and getting trafficked.
Yeah.
And then they find them, and then and before you know it, they're gone. They've either died from what they've gone through, or they're lost through disconnection or something like that.
I mean, it's hard to even wrap my head around what that would be like, to live in one of these states. Well, and really, I mean, this kind of thing has happened in Texas, where you have maybe a messy divorce, and that fractured relationship between parents is used as a leverage to take this kid to one of these states and then convince them that they're transgender, then use that to take the child away from the parent. Or you have two parents who they have a kid who, the kid gets groomed in school, right, during a difficult time during their development. And the kid will be taken away from the parents, put into the foster care system, and given these medications. And, what kind of life is that? And to give you a comparison, how difficult it is to take kids away from their parents. During COVID, child abuse got really bad, right? Like when we were working at TCH, we would see tons of cases of kids coming in just dead, right? Because, they weren't in school. So the mom's boyfriend was taking care of him, and, the mom shows up, the kid's dead, right? The kid fell, shaken, something. See that a lot, especially during that time because of the lockdowns. But there was a girl who showed up. She was 12 years old. We thought she was 7 because she looked so young, right? Because she looked so malnourished. She had cigar burns from head to toe, front and back. We x-rayed her head to toe. Not head to toe because, you want to limit radiation in children, but, tons of chronic rib fractures. Her blood count was like a patient who had leukemia because she was being malnourished. But the reason she came in is because her parents, as a form of punishment during the lockdowns, would put her hand into fans and chop off her fingers. But her thumb was hanging on. It was starting to get infected. So the parents brought him in. When I saw that patient a couple of days later, parents were in the room.
Wow. Yeah. During COVID, a lot of crazy things happened. A lot of things within society or culture began to change. A lot of influences from Hollywood, television, those sorts of things came to light. And we saw the best of some people, and we saw the worst of humanity in a lot of cases. Do you feel like the influence for the major uptick in these types of surgeries or in these requests for surgeries are coming through? Are they coming through the organic development of the trans culture, or would you say that it has anything to do with the types of programming, movies, social media that's making it so important for them?
Well, I think that, so it's the question is what was driving the proliferation of all this, right? And was it related to COVID? I think so. And the reason is two things, because two things that come from one thing, which is the lack of meaning, which is this big problem that has a bunch of different avenues, right? But that leads to two things. The proliferation of ideology in the medical establishment, and then the censorship of anyone who questions that ideology with the presentation of evidence. So when I say ideology, what I mean is like this emerging belief that truth is subjective, that it's not related to objective reality, that it's not, truth is not something to be observed or reliable results, but it's true if you say it's true. And it's one thing if this is in a college classroom, but it's a whole different thing when it's driving medical recommendations. So you had this ideology that was embedded within the highest levels of the medical establishment. And so many of us just didn't know. There were some people who knew, but I had no idea. Like I thought, like the first few days of the pandemic, I thought Anthony Fauci was like a stand-up guy. But then no, it turns out he's, like there's no words to describe how evil that guy is. Mm-hmm. I mean, somehow he became America's top doctor. I wouldn't let the guy take care of my goldfish, right? But like somehow he ran the whole country's COVID response. But so you have this ideology, and it's not based on facts. It's not based off of objective data, what we would call science, right? Reliable science. It's based on this ideology. But then second is you had censorship. If anyone had questioned it, you would be shut down in the most profound way possible. And I know this is true because I lived it, right? When I wouldn't introduce any doubt, express, and I was a pain in the ass. Like, I would push back to the extent I could, and people just would not have it, especially during the early days. And because of that, there was this chill in the medical institutions where people would just not say anything if they disagreed, if it went against the prevailing narrative. So it's only in this milieu that the transgender ideology can emerge from that and turn into like this brush fire that had turned the country upside down. Because without the ideology, you have no basis. Without the ideology that there's no objective truth, there's no transgender ideology. You have to have that for the transgender ideology. But without the censorship, or because of the censorship, you had this proliferate at the country's most prestigious institutions without any pushback.
Mm-hmm. So how do you, I think I know how you feel about the idea of using puberty blockers, hormone replacement therapy, and gender reassignment surgery as some kind of anecdote or therapy for gender dysphoria and body dysmorphia, which is totally unacceptable. It's not, it's more of an illusion of a therapy of types. And
yeah, it's like the illusion of short-term efficacy, just like opioids, right? You'll have a bunch of people in the 90s who said, oh, these opioids saved my life from chronic pain. A couple years later, they were using heroin, right? And it's the short-term illusion of benefit had driven that, right? It wasn't the belief in basic human dignity that caused all these doctors to turn their clinics into pill mills, right? It was their belief that they have evolved beyond human fallibility, that there is no such thing as human dignity.
That's an amazing thing to say. Do you think that right now we have seen a huge uptick in these sorts of surgeries and transitions because of top-down re-education and the teachings for the therapists and the doctors that you cannot question a child's gender identity? How dangerous is that, and what role really should they be playing in terms of putting the stops on?
Yeah, well, I mean, it's people in these institutions, therapists, psychologists, psychiatrists, endocrinologists, who have to be the ones who stand against it. Because it's one thing for the average citizen to stand against it, and they should do so vehemently. But the challenge has to come from the equals, the peer equals, right? Like in their profession, because you can have the average person say everything they want, but if there's not a pushback from doctors in the medical establishment, this will continue.
And you're experiencing the consequences right now of kind of fulfilling your role in that way, in that you see the pushback to the pushback is getting so extreme that nobody wants to question what they see as clearly wrong.
Well, it goes to show because that's like the whole other side of the story, right? It's when you have the federal government, which has obviously adopted this ideology, especially health and human services, the most dangerous threat to them is the average person speaking out against it, but being unafraid to speak out, which is, I think, why they had come after me. But, so we released a story with Rufo May 16th. And, it took me like months to get a hold of a journalist, but I finally got a hold of him at the best possible time, 2 weeks before about. And we go through the vetting process, make sure the story is legit. And I didn't know this at the time, but there was a vote in the Texas Senate on a law called Senate Bill 14, which was going to ban these hormone-related interventions for kids under 18 with gender dysphoria, right? So like ban all these procedures. And I didn't even know that was happening, but somehow I got in touch with him at the best possible moment because our story came out the very day before on May 16th, 2023. And because our story came out, there were multiple politicians on the other side of the aisle who we were told voted in favor of it because the story came out. Because for so many of us, they always tell us this isn't happening, but it's good that it is, right?
Mm-hmm.
But like the first thing is it's not happening. But the day before the vote, they found it was happening. It was happening in their districts. So within 24 hours of our story's release, the conduct we had exposed was voted to become illegal in the state of Texas in a bill that was passed with bipartisan support, right? So within 24 hours. But it didn't stop there. More whistleblowers, another whistleblower from the hospital came out who had worked with these doctors and talked about how they had seen these kids who had these profound psychiatric issues that were just being completely ignored, right? 30, 45-minute visit, blockers, hormones, out the door, right? Horrifying. And then you had the Attorney General announce an investigation to the hospital. And then, about a week and a half, 2 weeks later, the CEO of the hospital says that he's going to shut down the program in compliance with the law for the second time in 14 months. Hopefully this time they actually did do it. But remember, this time I was just the anonymous whistleblower. This was May 2023. And I was graduating from my surgical training June 23rd, so about a month later. And the graduation from surgical training is a big deal because you make so many sacrifices during the past 5 years. You miss birthdays, births of your nieces, such important life events that you'll never be able to get back. And so the day you graduate is a big deal because now you have this new responsibility of being a surgeon. And it's something that you carry and it's something that's so meaningful. So it was a big day. And so it was like 11, 12 o'clock Friday. My family was in town. We were getting ready to meet them later that afternoon for the ceremony. And then get an aggressive knock on the door. Oh man, who's that? So I shuffle over and I open it. And I'm wearing some stupid t-shirt and like some old shorts from college. And it's two federal agents. They show me their badges. They're with Health and Human Services. And they say they're investigating a case regarding medical records. So at that point, I knew my life, had completely changed from that point on.
It's such a big deal that, just like you said, you've gone through all that to get to that point of graduation, but you still held to your moral and ethical view of what was right and wrong. And then ultimately you had so much sacrifice that came on the tail of all this during that time. What would you say to others in your situation, whether students or seasoned professionals, when they think about all of the pushback that they're going to get or the consequences for speaking up with them? Yeah,
it's I think the best way to answer that question is maybe what happened right after, because I think portrayed a lesson. So I invited them in because the doorway was very awkward. We sit down. They start setting up a tripod just like you have over here to do an interview. But my wife comes out. She's a brilliant attorney. And we look at each other. We go to the bedroom. We're like, bad idea. Go back out. We tell them we want to talk to them without an attorney present. They say, okay, hand me a target letter. And, I know what a target letter was, but this is a letter on a piece of paper that says that I was a potential target of a criminal investigation. And it was signed by an assistant U.S. attorney in the Southern District of Texas. So the Federal Department of Justice is investigating me for some criminal thing. Who knows why? So a few minutes after that door opened, the door was closed. My wife and I are sitting there, and we knew that we had this crossroads. What were we going to do about it? And we're like, we can bend the knee. We can try to work with these people and just admit to something that didn't happen, just so we can get them off our back, like plead guilty to some petty misdemeanor and just make this all go away. Or we can fight it, stand up for what's true and what's right, probably lose everything that we've ever worked for. But the one thing we'll have is our dignity, right? And of course, we knew that was the only option. So we opened 2 bottles of champagne. We went on our patio. We put on like Vietnam War music, like Jimi Hendrix, Rolling Stones, like CCR, and Buffalo Springfield, other good jams. And we celebrated and planned our war strategy, how we're going to fight that. And since then it's been very difficult. But to answer your question, the message to other people would be, when it's a miscalculation on their part when they think, oh, I can't do this thing because I'm going to lose my job. I have to pay for my kids' college. They say I have to stay silent in order to sacrifice for my kids. But there's a certain point where the movements in our society are becoming so dangerous, so consuming, so depraved that calculus changes. For doctors like me to not do something about this, we are only putting our children, the people we're claiming to care about, into greater risk in the future. When we fail to stand up now, we're just passing the fight along to our kids. So the calculation is, no, we fight now to take care of our kids in the future, not stay silent now so that I can enjoy my retirement. Like, that's garbage. Mm-hmm. No, like, we had like hundreds of thousands of dollars saved, gone. Best investment I've ever made. Like we kiss that money goodbye to legal fees, but it's the way I can live truthfully, right, with dignity. And for people to know what that feels like, especially after living the way we've been living for so long, that's something meaningful and like something you can't put a price on. And like these prosecutors who are coming after me, right, like these agents who showed up to my door right on the day of my graduation, some slimy move, right? I mean, it's like to be able to stand against these people who supposedly call themselves Americans, like, no, it's the greatest feeling ever to be able to stand up for the principles of this country and for the principles of human dignity. And especially, we've seen it with like all the support we've gotten with the Give, Send, Go and everything. I mean, people are willing to be a part of the fight, they're willing to sacrifice something meaningful for a cause we're fighting for, right? And this is it. I mean, these are the worst people in our country, right?
Yeah, I like how you described that you guys kind of went out and celebrated to all those kind of like Vietnam, that music, and because it really is a very patriotic thing that you're doing in that moment. And I think that for the world who's watching your story and watching you stand up against these things that we know are very wrong, even at your level, you're standing up. You are like a poster boy of dignity because you have done that and you are speaking out.
Yeah, I would say maybe a poster boy because I know like I'm deeply flawed and many times an idiot, and and I try to always be better. Yeah, exactly. Yeah, but and that's really what it is. It's something to fight for, and I mean it's worth it because how boring would life be otherwise? I mean, this is a worthy fight, and I think, what do I have to be afraid of, right? Like we were thinking that day, like on the day of my graduation, why should we be afraid? Like they don't have anything. Obviously, this is political, as has been testified to in Congress. Like my attorneys had sent a letter to Congress outlining the misconduct from the assistant U.S. attorney. I mean, it's egregious, right? They had sent agents to my place without ever reviewing the evidence beforehand. It's like initiating a murder investigation without checking to see if the person's still alive. They had threatened my wife because she was undergoing a federal background check. to become an assistant U.S. attorney. My wife is an assistant U.S. attorney in the Northern District of Texas. So when she was undergoing the background check, they said, well, she'll only have problems with that background check if she becomes difficult. What they were referring to was her encouraging me to utilize my constitutional rights to have an attorney present when speaking with law enforcement, right? They even admitted that they would pursue me on a technicality, even though no laws had been broken, in order to make my name public so that other people can sue me and put me in financial ruin, right? These are people who are in our government who have the power to destroy people's lives. And they thought I was going to bend over, I was going to bend the knee when they showed up, right? Their intention was fear and intimidation. But they're coming to realize that they had knocked on the wrong door.
Yeah, that is so amazing. Not everybody has the courage or the integrity to stand against this. So I am actually, in this way, I'm glad that they messed with the wrong person, because now we're able to put them on blast and let everybody know what's happening, where this may have happened multiple times, never heard of it.
And I'll tell you what, it's everything that's false will crumble. Everything. If there's one rule in human nature and society that we know is true, is that anything false will crumble. The decision we have to make is how we respond during those moments of challenge. Because if we don't do something now, right, if you stay silent, if you're a doctor and you stay silent, you let this happen, you don't do anything about it, then soon your kids or future generations are going to ask, what did you do when this was happening? And you have to live with that shame every single day. So when you think about it in that way, what's more difficult? Is it more difficult for me to do this or to live a life of shame and destitution? No, it's the former is much easier than the latter.
Mm-hmm.
And people, I think, are starting to realize that. Like, you can't look in yourself in the mirror every day. If I were to, like pretend like this investigation is legitimate.
Mm-hmm.
No. I mean, it's a kabuki theater.
So that was an amazing talk that you gave us. You're not going to stop this war that you're on, this war path that we're all in with you here, which is amazing.
Yeah. I mean, there's no option, especially at this point, if they're doing this to our kids in these schools. And like what world can we possibly live in? Just imagine if we don't do something, like what it's going to look like in like 3 or 4 years. It's crazy.
Absolutely. So for everybody listening or watching who wants to support this man, who's given so much of his personal resources and so much personal sacrifice in order to stand up for the truths that we're all out here doing our activism for, that we're internally wondering what's going on in the world. This is somebody who's actually put their life and their livelihood on the line. How can they contribute to help you while you fight this uphill battle?
Yeah, well, we have GiveSendGo. It's giveSendGo.com/Texas_whistleblower. And every day, my wife and I, we read every single comment, every single new comment. It's like the greatest thing I've ever experienced in my life. Because when you think, like when you do something like this, you have no idea what's going to happen. Like you're going to step into this world of darkness and like you think your life is going to be destroyed. And like you will have to sacrifice things, but then you go into it and you realize that there's actually, no, it's not that bad. Like it's not darkness. It's actually this much greener. Like there's these amazing people, and you get to meet people who care about things that matter, like human dignity and truth and love and beauty. And, people also, I realized they want to fight because people are coming to the realization that what we're up against is something very, very bad. And when we have our legal fund, it's important for people to know it's not only defense, but it's offense. We had sent a letter to Chip Roy and Jim Jordan in the Judiciary Committee outlining the misconduct at the Department of Justice. And we will pursue that investigation. Like we will get that through. We will hold these people accountable for what they're doing, because my case is meaningless if we don't hold those people accountable for abusing their authority. Like otherwise I'm just, here like yanking my chain, it's like, it's meaningless. Like, no, like we have to achieve accountability, because if not that, then nothing.
Exactly. It's a defense, but it's got to be an offense. We
Yeah.
got to have them on the ropes because
Yeah.
they're in the wrong here.
And yeah, exactly. I mean, they were the ones. Like, it's when you read the content of this letter, you look at it and you're like, oh my God, like this is not the country we grew up in.
Mhm.
So
Absolutely. There is a Marxist agenda afoot.
Yeah.
A globalist Marxist agenda,
yeah.
for that matter. Well, thank you so much, Eithan, for your time. And we look forward to your feedback, viewers and listeners, and your support for this man right here.
Yeah. Thank you.
Thank
I
you.
appreciate it.